So have you had any problem with dealing with the tech side of this business of the company? If yes, what were the problems, and how do you go about solving for them?
I can't speak to actually if we had that. I don't. I mean, we tend to hire relatively experienced people. We tend to hire people that again are merged by that vision. So I can't actually speak to what we do there. I do know that I've worked with people where that became a huge challenge because of the entire incentive. You need to understand, right? And I don't need to tell you that, but the entire incentive of in healthcare, patient safety comes first, right? So nothing that's safe will get used or can show that it's safe will get used, will get seen, anything. That is very difficult for some of the more technology driven people because they would always assume that if something's better, it will get used. And that's not the case. Only if the checkbox of patient safety is done, then that comes in. That means that people coming from tech tend to have the tendency to think healthcare moves too slowly. And healthcare does move slowly, but healthcare moves slowly for a very good reason. And that aspect sort of can be a challenge, not so much because you bring the wrong skill set, because most of the time, if the problem is laid out correctly by, be it the CTO, be it the COO, be it somebody who understands like sort of that healthcare landscape and can translate to tech, if that is laid out clearly, then the problems themselves in health tech are never technology. The technology can do all the things that you want. It's always how it gets adopted, how it gets communicated, how it gets implemented, and what works, right? That is the part that where everything, 99.9% of technologies fail because of that, not because of the technology. And I think that's something that is very difficult for some people to manage, because you could argue, and I've heard some people argue that technically healthcare for tech is boring because the challenges on the technology side are not there. You will have to be intrigued by and driven by that sort of need to help patients and to change things, and by the intricacies that come with it, right? Like, how do I build something that that can actually be adopted? And how can I support that overall mission? But that is the part that is fundamental to it.
Thanks for watching, and I appreciate you as a valuable viewer. And if you liked this segment, you can watch all of the different individual segments or the whole podcast to have a broader understanding on this topic. Just check the links in the description or what you see on the screen right now. I'm Dr. Umer Khan. Looking forward to seeing you again. Thank you.